This is Dr. Chestnut. Thanks for watching, taking your time to try to understand what I'm writing about here. Uh, this is one of my favorite topics because it's something new. It's really changed, and it's much more effective. Our previous understanding of back pain was sciatica and a degenerated disc, a bulging disc, a ruptured disc, an extruded disc. Well, we found another category we didn't know about. And this category we can treat very easily without surgery with a high success rate and essentially no complications. And it turns out, at least one article that I read, it's estimated that 53% of all low back pain in the United States is due to this condition. So this new condition actually explains at least half of the back pain we get. And it probably is a significant part of the other half from degenerating discs, etc., spinal stenosis, the other things. Lumbago is just the Latin term for pain in the back, and we often use it when we don't know the diagnosis. It's just the low back pain. Um, this starts about age 40 or 50, it seems, in my practice, and you can diagnose yourself by the symptoms because this has a very fixed standard symptom complex. Lumbago is a long-lasting ache in the back due to continuous muscle spasm. It is steady, lasts for hours, does not vary in severity like a muscle cramp. It just stays aching. It may come on at night, keep you awake. It can go down into your pelvis in the hip pocket area, around the side to your hips, and down your thighs, sometimes to the knees, period. It doesn't go below the knees. If you're having things going below the knees, that's a different kind of problem. So the symptoms here are a steady, hard ache in the low back and in the pelvis, maybe side of the hips, maybe the thighs, front or back, down to the knee. It just progressively gets worse for most people and becomes a nuisance at first, and you want to stretch and do yoga. And then as it progresses, it gets to be really a major handicap, and the pain can become so strong you need pain pills. For most people, it's brought on by a particular prolonged activity, such as sitting or walking. It seems more common with walking and standing that people get this rather than with prolonged sitting. And it is a back spasm of the deepest back muscle called the multifidus. And this is a fairly flat muscle right on the vertebra, and it's covered by all the other muscles of your back. So it's not something you can reach by doing massage, heat, ice, all of those. You feel like you want to massage it. It feels like a muscle spasm, but you do it or have somebody else do it, and you don't feel better. One of the characteristics of this syndrome is that chiropractic manipulation often helps. I've seen a figure that about 45% of the time chiropractic for the low back is helpful. It is obvious in one or two sessions if it's going to help, and it's a safe way to, as far as I know here in Albuquerque, it's a very safe way to get relief quickly if it works for you. You're fortunate if it does. I have seen 5 cases or know of 5 cases and seen 2 personally of strokes from manipulation of the neck. So don't have your neck manipulated. That's an entirely different risk pattern. Now, the name of this scientific name of what I'm talking about is called lumbar facet syndrome. Lumbar facets are the little joints between the vertebra, and they wear as we move around. These are not down in the spine. They're not down amongst your nerves in the within the dura. These are like shingles on the roof of your house on the outside. So that's why this is a safer thing to treat. The way we treat it is first to start with a lumbar joint, a facet joint block, and block means using local anesthesia. It's usually one of 3 joints on the right or on the left or both. And so a trained person in doing this injects under x-ray control local anesthesia, and that takes about 5 minutes, and then that joint's numb for about 5 hours. And by fooling around with the injections, you and your pain physician can figure out which joints is causing the pain. And then Most people do put some steroid in there because sometimes they find that they will get months of relief with that and they don't have to go to the next step. But the next step is the one that gives you years of relief, and it's down here called rhizotomy or radio frequency ablation of the nerve. So once we know which nerve, which joint it is, we can actually numb that joint for 3 or 4 years typically. Then that's also done in the office just by numbing the skin and putting a little probe in that's the size of a needle that has a tip on it that heats very high. So you just cook the nerve, and it takes years to get back to work. So for many years you're numb in that particular joint. So it'd be common to do either 3 or 6 joints in the low back of a typical middle-aged person having lumbar facet syndrome. And then here's just an example of pain patterns. This is where you get this lumbago right in here. This kind of pain going down to the foot is sciatica, and these patterns will relate to other things up there. But lumbar facet is the new thing. Um, People often will have a lot of this and a little bit of a bulging disc or something else, but this is the safe outpatient thing that we can treat and usually manage for years at a time without surgery.